Health insurance is a necessity, not a luxury. I often ask myself, is health insurance important in the United States? Healthcare is constantly changing. We are always developing new treatments to treat different diagnoses or different diseases. With the help of technology, we develop the most advanced treatments there are, especially here in the United States. Reimbursement is constantly changing also. Every insurance has different fee schedules, and everybody pays and reimburses at a different amount. For example, private insurance, state insurance, and federal insurance. Private insurance usually reimburses more than the state and the federal. And every year or every few years, there's a change in the fee schedule. The way we practice medicine is also constantly changing. We often have new regulations that come from WPS Medicare or CDC, and they let us know how to practice and what rules and regulations to follow in order to provide quality care for our patients. Physicians see different types of patients. These patients include insured, underinsured, and uninsured. Insured patients are those that have health coverage, for example, a commercial insurance. Underinsured patients are those that have state health coverage or plans that might not cover everything that they need covered. Uninsured patients are those that have no health care coverage. They are self-pay and usually pay for everything out of pocket. Health coverage is needed for everything. It's needed to see the doctor for treatment. It's needed when the doctor orders additional testing. It's needed if the doctor prescribes a medication to help with your illness, and it's especially needed to perform any type of surgical procedures. We all have basic needs. These needs include food and groceries, housing, and health coverage. It's important to have food because it's needed to live a long life, it's needed to stay strong, it's needed for nourishment, it's needed to stay alive. Housing is another need. It's needed to stay warm in the winter, it's needed for protection from natural disasters, and it's needed to stay cool in the summer. Just as important is health coverage. It's needed to live a long life, it's needed to stay healthy, for regular checkups, and for preventative care. In the article, I Can't Afford That, physicians are faced with different dilemmas when treating patients that are uninsured or underinsured. One of the dilemmas they face is dumping a patient into another provider or hospital, which is basically referring a patient to somebody else because their inability to pay. Another dilemma they face is foregoing indicated tests that they feel that it's required under their standard of care. Depending on the diagnosis, a physician may feel that the patient needs an MRI or an ultrasound. However, because the patient's inability to pay, then they don't do the required testing. The testing does not get done, and the standard of care is lowered due to this. The physician is faced with taking a different route or a different approach to the diagnosis and being able to treat the patient without the required ultrasound or MRI that they thought was needed. Another dilemma a physician faces is reducing fees. For example, a new patient might come into the office and the physician would spend an hour and a half or more with the patient discussing what the treatment option is, performing an exam, and what they should do next. However, because the patient's inability to pay or the patient does not have insurance, then the physician will usually undercode and not bill what it's supposed to. These three dilemmas are faced by physicians every day. We need to find solutions to one of our nation's biggest problems, which is uninsured patients. One of the solutions would be to provide health coverage that is affordable, accessible, and provides quality care. Another solution is to offer universal health care for the nation. However, with universal health care brings some questions. For example, the availability of resources. How long does a patient have to wait for a procedure to be done at no cost? And how often can a patient visit their provider at no cost? Another solution is finding ways to keep our nation healthy. This may include offering preventative care, regular checkups to diagnose and treat a disease that we have recently found. If we are able to treat the disease at the early stage, this will save money in the long run.